peripheral blood stem cell mobilization. We often mobilize stem cells with GCSF, colony stimulating factor, or with GCSF Plerixafor, or chemotherapy plus GCSF, or chemotherapy plus GCSF plus Plerixafor. GCSF could increase the number of neutrophils, monocytes, T cells, NK cells, and B cells. The amount of stem cells collected was based on recipient body weight. The minimal number of cells, 2 times 10 to 8 per kilogram nucleated cells, or 2 times 10 to 6 per kilogram CD34 positive cells. The factors influencing successful mobilization include pelvic or abdominal irradiation, marrow hypercellularity, prior stem cell toxic agent, prior chemotherapy regimen, the age of the patient, or the type of underlying disease. Harvesting stem cells. The adult stem cell was obtained by large volume marrow aspiration. The cord blood stem cell was obtained at delivery by sterile emptying umbilical cord and placenta into the blood donation bag. The processing of peripheral blood of patients and healthy donors. They isolated in real time from blood after stimulation with blood cell growth factors. The stem cells can be frozen from up to 5 to 10 years. This is a collection of hematopoietic stem cells from the bone marrow in the operation room or from peripheral blood by a cell separator. The bone marrow stem cell was harvested from the posterior or anterior iliac crest. This is a peripheral blood stem cell collection by a machine called CS3000+. The stem cell was infused into the body of the patient intravenously. The stem cell homing is a phenomenon whereby peripheral blood stem cells migrate and establish residence in the bone marrow. Transplanted stem cells homing is essential for sustaining hematopoietic restriction. The regulation of stem cell mobilization and homing. The retention of stem cells in the bone marrow are controlled by adhesive interaction, which was regulated by SCF, SDF1, and CXCR4. Stem cell mobilization needs to break this balance. The SDF1 CXCR4 is critical for stem cell mobilization and homing. SDF1 means the stroma cell-derived factor 1, which is expressed by stroma cells, and CXCR4 is a chemokine receptor for SDF1. CXCR4 expression is depressed in mobilized stem cells and is elevated in the homing of stem cells. The recovery of stem cells. After transplantation, the patient usually experiences a neutropenic phase, which lasted for 2 to 4 weeks during this period. During this period, the patient essentially has no effective immune system. Therefore, the supportive care and antibiotic therapy are the mainstays of successful passage through this phase. After the neutropenic phase, the patient will experience an engraftment phase. The recovery of normal level of cells is called engraftment. For bone marrow transplantation, the engraftment phase would last 2 to 6 weeks. For peripheral blood stem cell transplantation, the engraftment phase lasted 8 to 10 days for neutrophils and 10 to 12 days for platelets. For cord blood transplantation, The engraftment phase lasted for 4 weeks for neutrophil to recover. The neutrophil engraftment is important. Platelets are the next to return, with the red cells last. The patients usually require transfusion of red blood cells and platelets. Hematopoietic reconstitution. The immunologic reconstitution usually lasted over 100 days post-transplantation. The graft versus host delays. The GVHD would delay the immune reconstitution. The immune deficit, usually due to T cell and B cell dysfunction, the low immunoglobulin levels for 3 months. The normal IgG and IgM usually require 1 year, and IgA usually by 2 years. At this time, the patient is predisposed to fungal, viral, and bacterial infection. That's the end of this part. See you later.